Hi, my name is Katina Gurley, and today I'm going to take a few moments to talk to you about medication errors, which is taught in the Nursing 330 course titled Law and Ethics for Healthcare at the University of Mount Olive RN to BSN program. This video is an assignment for my Master of Science in Nursing degree program at the University of Mount Olive. This short 5-minute lecture will be using the cognitive learning theory principles of Wolfgang Kohler, Max Wertheimer, and Kurt Koffler. The goal of this presentation is for the learner to understand how medication errors can be reduced. There are two objectives. The first objective for this program is that the learner will be able to verbalize the definition of a medication error. The second objective is the learner will be able to verbalize the importance of barcode scanning, patient armbands, and medications prior to med administration. First, I'd like to give you a brief overview on medication errors. According to the National Coordinating Council for Medication Error Reporting and Prevention, a medication error is considered any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, the patient, or consumer. According to the 1999 report from the Institute of Medicine, between 44,000 and 98,000 deaths that happen in hospitals each year are the result of medication errors. One way to reduce med errors are by barcode scanning the patient's armbands and the medications prior to medication administration. The person administering the med would scan the patient's armband and the medication to assure that it is the right patient and the right medication. If by chance it's the wrong patient or wrong medication, an alert will be sent. Now I'd like to talk to you about an example of a medication error. An example would be a patient was ordered Haldol decanoate by IM injection, but instead received insulin by IM. Both vials were in the patient's drawer, but the facility did not have barcode scanning prior to the patient receiving the medication. This could have been prevented had the facility implemented barcode scanning of medications and patients' armbands. The facility has now implemented barcode scanning of medications prior to med administration. The facility does not have electronic medical record, so therefore they do not scan the patient's armbands prior to med administration. If they would implement this, that would be an added protection feature. Another protection feature that the facility implemented was there's rings around the neck of the vials of insulin labeled insulin. That's for added protection of future errors involving insulin. This brief lecture on medication errors and the importance of barcode scanning medications and the patient's armbands is supported by current evidence found by a multidisciplinary team study in 2007 by Paolete, Seuss, Lesko, Fiorelli, Kennel, Mahler, and Sanders that found a 54% decrease in medication errors after the implementation of barcoding and electronic medical record. I would like to thank you for your time and attention today. Please complete the short survey provided through the Nursing Student Center and email it to my professor, Dr. Jennifer Sugg, at the email address jsugg@umo.edu within the next 3 days. Thank you.